Hello and welcome to the live stream of CGTN online medical consultation on the treatment of the COVID-19 infection. Thank you so much for investing your time with us. My name is Tom Bohr from China Global Television Network, and I'm hosting today's online meeting. Today we have an amazing panel where medical professionals from China and Italy will exchange views on, but not limited to, COVID-19 patient diagnosis and treatment, reducing fatality rate, and medics protection. We will also take a closer look at Italy's hospital administration under the European context and discuss on how to better collaborate. If you have any questions, please leave them in our comment section using hashtag #MyOpinion on COVID-19 to share your views. We will take your questions to the professionals and discuss them in the live stream. So first of all, I'd like to introduce our guests from the Peking Union Medical College Hospital from Beijing. They are part of over 180 medics from the hospital who have been dispatched to Wuhan and have been combating the virus at a local hospital for over 2 months. Now, first of all, we have Professor Zhang Shuyang, Secretary of the CPC Party Committee branch of the hospital. She is also the Vice Chairman and Secretary General of the China Alliance for Rare Diseases. She is now the leader of the assistant medical team of the hospital in Wuhan. And also we have Dr. Wu Dong, Associate Professor of Gastroenterology in the hospital, and Dr. Fan Junping. He's got expertise on both common respiratory diseases and critical care. And we have Dr. Ding Xin, dedicated to the diagnosis and treatment of critical diseases, and Xiao Meng, Assistant Professor and Assistant Director of Department of Laboratory Medicine of the hospital. And we also have Tan Xiao, Dr. Tan Xiao, and is the physiologist from the hospital. And at last but not least, Dr. Xie Jing, an assistant professor at the Department of the Infectious Diseases of the university. Welcome you all. And also we have guests from Italy's San Raffaele Research Hospital, and also medical professors from Niguarda Hospital in northern Italy. Welcome. Before we dive into the discussion, two very special guests will deliver short speeches for today's online meeting. They are Mr. Yao Liangjun, First Secretary, Science and Technology Office, Chinese Embassy in Italy, and Dr. Guisi Condolelli, Health Attaché, Italian Ministry of Health Representative to China. Thank you very much for your time. So let's start with Mr. Yao. Can you give us a brief introduction and what you want to share with us? Welcome.
Very glad to this video meeting. As we know, both China and Italy have taken rigorous measures to prevent the spread of the epidemic coronavirus. China at present, China has made decisive success, and Italy has also achieved significant results. Since the outbreak of the epidemic, China has shared the entire genetic sequence of the virus to the world, providing an important basis for the drugs, for the vaccine and diagnostic research. The Italian scientists have also isolated the Italian species virus in the first time. The experts from China and Italy carried out a lot of exchanges on technology and experience. In February, a video connection between the Chinese expert and the Italian treatment team was held to conduct consultations on 2 Chinese patients in the Spallanzani Hospital in Rome. in this, I must thank the Italian doctors for their excellent treatment. That these two Chinese now are now in normal recovery. In March, China dispatched to Italy three medical teams consist of 36 experts and doctors. They went to the hospital, the epicenter hospitals, to communicate and to share with Italian colleagues the Chinese clinical experience, which are very much welcomed. We are very pleased to see that the Shanghai Institute of Molecular Medica of the Chinese Academy of Sciences is working together with the Italian company Dongdae to developing new drugs to cure the COVID-19. As a matter of fact, China and Italy have a very close science and technology cooperation. We have also a long history, traditional friendship and a comprehensive strategic partnership. Italy is the first G7 country to sign the Memorandum of Understanding of the One Belt, One Road initiative. We cherish this, our special friendship. I believe that China and Italy will successfully overcome the epidemic together. From Chinese Embassy, we fully support your communication and joint medical research. We also support science and technology cooperation in various fields between our two countries. Thank you all.
Thank you very much, Mr. Yao Liangjun from the Chinese Embassy in Italy. And then we have Dr. Bussi Condolani, and Health Attaché from Italy, Italian Ministry of Health representative to China. So please.
Mute.
You have to unmute.
Sorry.
Okay, good.
Sorry, can you hear me?
Yes, we can hear you good.
No, okay, sorry. I have to slot here. I
Go
see
ahead.
my name twice because I have some problem. Sorry, I have two devices. I'm connected with my iPad and also with my computer. So good morning and good afternoon for the Chinese side. I'm the health expert of the Italian Embassy in Beijing, and I'm also the representative of the Italian Ministry of Health here in China. And I'm really honored to be here first because I'm a medical doctor, as most of you. Let me say thank you for the invitation to Dongdae pharmaceutical company with which the embassy have been working lately. This webinar is a brilliant initiative that is particularly appropriate in this moment of the serious health emergency that see Italy and China busily collaborating to eradicate the COVID-19 epidemic. So the cooperation between Italy and China has enjoyed a long and fruitful history since its inception in the early 90s. And after, in the year 2000, the Ministry of Health in China and Italy reinforced their ties by signing a memorandum of understanding in Rome, which has been implemented via triennial action plans. The current action plan was signed 1 year ago in Rome during the visit of the Chinese President Xi Jinping. So recently, the Italian Minister of Health, Roberto Speranza, and the Chinese Minister of Health, Ma Xiaowei, signed the implementation program of bilateral cooperation exactly on November 2019 in Rome. And during that meeting, the training of health professionals was one of the topics discussed between the two ministries. So this event, of course, is in line with the government policy. And in the recent years, many joint bilateral activities have been successfully carried out in various sectors of health. One of the tasks of the embassy, as my colleague in Rome said, is support this kind of cooperation. So for the future, don't hesitate to contact us if you need our support for this kind of cooperation. So I don't want to take any more time from you because I want to hear the voice of the experts. I'm sure that this webinar will allow you to begin the exchange of knowledge and experience in the medical scientific field between our two countries. So in conclusion, I want to express my personal and sincere appreciation to all the courage and dedication shown by Chinese doctor first and the Italian doctor after, involved in the front line addressing the health emergency caused by the coronavirus epidemic. So thank you and enjoy the webinar.
Okay, thank you, Dr. Condoleezza. So now I think we're good to start our discussion. Let's start with Professor Zhang. Anything you want to say about it with our guest from Italy? Yes.
Yes. I'm Shuyang Zhang. I'm a doctor too. I'm a cardiologist actually. And I have been working with my physicians and nurses in Wuhan for 2 months, more than 2 months. Just as you know, the Chinese doctors going ahead some period of time in the world. So we collected and accumulated some experience in treatment of the coronavirus patients. And we appreciate this opportunity. I appreciate CCTV very much. Gave us this platform to show off experience to the world. And I think in this period of time of today, our team members will show their experiences. Whenever you have whenever you have some questions, okay, and we can start from now on. And I really appreciate the friendship between two countries. Now we face the same problem for the public big epidemic for coronavirus 19. This really is a very severe virus infection. We have to give very strong measures, to give them control powerful. Otherwise, this epidemic cannot be under control. And every single person is very sensitive to this kind of virus infection, especially to doctors. I just want to say, I just want to share my experience. Give them enough safety, ensure they're in safety, then they can face to give the good care to patients.
Thank you. Any questions from our Italian guests about the pandemic and patient treatment and management? And what about guests and professionals from the San Raffaele hospitals?
Say something? Okay.
Yeah, any questions?
My name is Gianvito Martino. I'm the scientific director of the San Raffaele Institute. Professor Fabio Ciceri is the head of hematology and is also the deputy director for clinical research. And Professor Ciceri is in charge of running the COVID clinical research part of what we are doing. Professor Luca Guidotti, who is a virologist, who is already working a lot with Chinese in the field of virology, and is also the Deputy Director for Basic Research in our institute. And Dr. Paola Larghi, who is the Scientific Secretariat of our institute. So we are very pleased and happy to be here. We are very honored that you'd like to share with us what you have been experiencing. Our hospital is unfortunately on the front line of this emergency because we are one of the major hubs in Lombardy region taking care of this pandemic. So we have been involved since the beginning, and within our entire group, which is formed by more than 20 hospitals around Lombardy, we have been taking care of more than 2,500 COVID patients so far, and therefore in San Rafael in particular, we have been taking care of more than 700 patients so far, and therefore we are unfortunately accumulating a lot of experience with this real, very life-threatening pandemics. Apart from taking care of our patients as best as we can, we have been setting up a program, a research program, to try to understand a little bit more about this infection. So we are working in two areas in parallel, of course. One is research area in which we are trying, as you know, to develop assays to improve our diagnostic performances and also therapy, as you know much better than us. And on the same time, we have been running a research project which is long-term, because of course this pandemic is not going to end up very soon, and we might understand exactly what it is in order to envisage more or less which would be our future. So we are very, very honored to be here and to share with you whatever we think is appropriate, and let me thank the Italian Embassy and the Chinese Embassy for their support. And of course, Dompe Pharmaceutical, they are close friends. We are working together. We have been working together, and we will be working together with them because it's one of our major pharmaceutical company in Italy developing new drugs, and maybe some of those drugs could be also useful in this particular pandemic. So thank you very much again for inviting us to participate, and we are ready to share information and whatever is important to try to end up this unfortunately very bad situation we are experiencing. Thank you very much again.
Thank you. Any questions? Well, actually, I have a question for Dr. Martino, that what measures have been taken to protect local medics from the virus? Because we know that a large number of medics professionals have been infected by the virus. So what measures have been taken for protection?
Are you asking how many healthcare workers got infected?
Yeah, what measures have been taken to protect them? How do you protect them?
I will leave the word to Professor Ciceri.
So, of course, we had a very, let's say, dynamic situation. At the very beginning was, I would say, something different than what it's applied now. But overall, we have around 100 people symptomatically infected. We calculate around 1,200 workers for between if you sum doctors, nurses, and all the technical personnel around patients. So front line for patients and for families. Of course, again, this has been dynamic because at the beginning, then we applied very severe restrictions for outpatients, and so I think that at the beginning we paid the price of a few days, but then we applied systematically monitoring, and all workers that had any symptoms related stay at home, and so we monitored. But overall was this, and no, with one exception, no one case was severe. So we had just one patient admitted, one worker admitted. Yeah. Among those 100, 80 was back to work over 3 weeks. But we still are facing positive swabs. We have around 70% of positive swabs at 2 weeks after completion of symptoms. So we are facing the fact that the quarantine perhaps is more 3 weeks than 2, in order to have 2 swabs negative as a green light to come back to work. Of course, most of those that have been infected went back to work. They were assigned to COVID area working. At this time, we still don't have antibodies check in workers. We are very close to start screening phase for all the workers in the hospital with neutralizing antibodies testing, and we hope that we'll start next week.
Regarding this last issue Professor Ciceri was alluding to, can I ask you one thing, because you are of course much more experienced than us. There are some rumors that you can develop neutralizing antibody, but at the same time you are still capable of infecting people because the virus is still living in the body. Is this true? I mean, the question is, having neutralizing antibody and maybe having a high titer of those antibodies is protective, or you cannot exclude that although you have antibodies, you still have the virus around the body?
Yeah, I heard your question on neutralizing antibodies. But I'm not sure whether, because you mentioned the plan to testing your healthcare staff for neutralizing antibodies next week. But in China, actually, we have commercial product testing the SARS-CoV-2 specific IgM, IgG, but we are not sure whether, for example, the IgG is a neutralizing antibody. But according to our experience and the current publications, we can see from the Warlord study. Okay, I'll try to reduce my.
Dr. Martino, can you hear us good?
Unfortunately, I couldn't hear very clear. I didn't get exactly because the audio is not the best possible.
没有，等于是传这个，不是这个，它最后拿一个电脑。对。
Sorry, maybe.
Sorry, because we only have one microphone here.
What about now?
Can you hear me, Ryan?
Now it's better.
Okay. Thank you. So I heard you're applying for testing the healthcare workers for neutralizing antibody next week, right? But now in China, we have commercial products for testing antibody, for example, the SARS-CoV-2 specific IgM and IgG. But actually, we now currently do not know whether the IgG represents a neutralizing antibody. So this is one current fact. Another thing is, from our experience and from publications, we can see this disease, the COVID-19, actually have a very high viral load, and we can get positive viral culture from upper respiratory samples within 1 week from symptom onset. But after 1 week or 10 days, actually, the viral load just significantly decreased. And at the meantime, around from 5 days to 7 days, the patients have a positive seroconversion for IgM and IgG. So these two processes have time correlations or associations, but whether they have scientific correlation, they do need further research or study on that. But in our ICU, actually we accept the most critical ill patients, and most of them have a disease on site more than 20 days or 3 weeks. So from the molecular testing, we rarely got positive screen molecular testing from them, which means the viral load in these patients are very low. And we believe that the capacity for virus spread to others are limited. This is our experience in this field. Thank you.
I have a question for you, again, Ciceri. Did you consider or have any experience in prophylaxis with any potential agent in workers at exposed condition? Let's say hydroxychloroquine or any other antiviral measure. Did you have experience in that?
那个你
过了，
不要动，不要动，
Okay.
你试试，
Okay,
你先做。
have another doctor to answer the question. 不行，不能用那个，不要用那个，用这个。谢老师不能用那个。
过来一点，垫着。
那个你们别搬这个。
OK， 好，再试试。
还是搬地儿别好，让他怕出问题。
这不是静音了吗？OK，静音了。
一会儿你们就争取换地儿，别来回搬那个电脑。
OK。
采取最有效的方法，已经实现的、成功的就别动它了。
OK。
是需要弄一下吗？
I will take this question regarding the prophylaxis agent. Up to now, as far as we know, there's no any drugs can be used to prevent this virus infection.
Okay, so you don't have experience in that.
So can I ask you one thing in this? I mean, are you still using hydroxychloroquine as a way of preventing the worsening of the disease? Is the Plaquenil drug, you know, the chloroquine, hydroxychloroquine, hydroxychloroquine.
No, we don't use it.
What about, if I may ask,
或者是那谁那
you
个
had the chance
俊
of
平。
using remdesivir from Gilead as an antiviral?
那个瑞德西韦，
You had the
就问了
chance
瑞
to
德西韦。
use remdesivir as an antiviral from Gilead at your hospital, and what is your experience with remdesivir?
Oh yes, yes, we have all the access to the medications you mentioned, but unfortunately we don't use them routinely or regularly because we have witnessed in our practice that none of those medications has proved effective enough to convince us to use them. And on the other hand, we all know that the evidence level supporting all these medications are quite low. And we have noticed that withdrawal of the paper, the first paper supporting use of medication has also come into place. So given all these considerations, we don't use these medications or rely on these medications to prevent the infection or prevent the progression of the disease severities. That's our opinion.
Good, very good.
Okay.
So are you another question, if I may? So you are saying that you are only using symptomatic therapy for patients, nothing related with viruses, infection, or whatever. This is
Right,
correct?
right.
We use robust supportive care, which includes mechanical ventilation, prompt ventilation if necessary, and we use low molecular heparin to treat those patients with signs of DIC. And we use, we also encourage, because some of our patients has undergone the stages of those critical illness and go all the way to recovery and withdraw. We encourage them to get off the bed, use our staffs to move them out of bed. And we also use early enteral nutrition as well as antibiotics to treat secondary infection. So we believe all these kind of things can play the role. We could not possibly believe any single medication to treat the disease successfully.
No, we're
Very
taking.
clear. Thank you very much.
Yeah,
Yeah.
sorry.
Yeah, one of our doctors has something to add.
To develop specific drugs.
Can you repeat your question again?
No, we were just saying that that's the reason why we have to develop research very much
Yes.
the best treatment for this viral infection.
And I have something to add. Well, just as we know, we have tested all our patients in the critical care unit, and most of them, the viral test has been negative, just because they have been the disease onset for quite some time. So we believe for the ICU patients, disease is not, the virus is not the cause of their severe disease status, but something left by the virus. So from this perspective, antivirus is less useful in these patients, but a very, a bundle of supportive care, including mechanical ventilation, is helpful, at least in some of these patients.
We agree. It's our belief as well.
Okay, thank you very much.
In agreement with that.
Yes, any questions from Dr. Michele Spinelli, I guess? Dr. Spinelli. Unmute yourself before you speak. Yes, good.
I think our doctors should share our experience about the patients once get infected, the course of the disease divided into some 3 periods. And according to the different period, you have the different choice to give the patient treatment. Yes. And you collect some experience now, so you can tell Italian physicians that probably is helpful to them.
这个不同的病程的阶段呢 ，dynamic change 是不同的。这个你应该说一说。头1周、中间2周，头1周主要的病情是什么？是病毒感染，要抗病毒。中间那个周是什么？
Yeah, and our doctors are going to share their experience on treating patients during different phases of patient management.
Michele, volevi aggiungere tu qualcosa?
Yes, I think that in Niguarda we had the same approach that you could describe. In this moment, we have 96 beds of intensive care for COVID patients. We have about 300 beds dedicated in patients with post-COVID or with not necessity of intensive care, but with necessity of ventilation, non-invasive ventilation. And the guidelines in this moment are the same, to use a good ventilation, to have a precautious mobilization of the patients, and the diet. As use of chloroquine or other things, there are some attempts, but nothing that in this moment is recommended. And so thank you for the occasion to participate and to listen to your strategies. Dr. Chiagato was not able to be present. I am not an intensivist. I work in the spinal unit, and it's strange, but we are one of the only departments in which we have not COVID, because we had a strategy from the beginning of really severe restriction, because we have in this moment 32 patients, 21 are very frail patients, tetraplegics, and it will be a big problem if we have infection inside. Thank you for the invitation.
Thank you, Dr. Wu.
Yeah, I totally agree with you. It must be very difficult time, as we have just gone through about 2 months ago when we first arrived at Wuhan from Beijing. So I totally understand what kind of difficult situation you guys are in now. So we are willing to do whatever we can to help you to get through with us together. So in terms of the treating this COVID-19 epidemic, our experience is that we should divide patients into different types. The first type is for the vast majority of patients with no major pre-existing conditions, and they just recover with only symptomatic care. The second part of patients is about 10 to 20%. They will need to be hospitalized. They need oxygen, they need fluid, they need nutrition. But most of these patients can recover after a prolonged stay in hospital without to be intubated and put to a mechanical ventilation. So for this type of patients, I think the steroid, the anti-inflammatory medications, all these theories could be useful in certain part of it. But we need to do more investigations and studies to look into it. The third part is the patients that we are dealing with in the ICU. These patients are very sick. They have a multi or single organ failure, and they are intubated. They're put to the mechanical ventilator. The mortality of this group of patients is very high. You need tremendous resources to be spent on them. You need lots of doctors and nurses. They will need all the supportive care I just have mentioned. This is our opinion. Thank you.
Can I have your suggestion for a very practical scenario? So in these days, we are facing, hopefully, a rapid decrease of the admission of new cases. So they are really dropping down very rapidly. We think that this is the effect of the restrictions, severe restrictions, rules that we applied in the metropolitan area. And, well, we went through a phase in which from 50 to 70 new cases of severe respiratory distress syndrome per day. Now we have no more than 1, 2. So it's really decreasing. So we are considering to build up a new phase for the hospital, because we would like to restart offering all the full spectrum of assistance to all the rest of diseases and pathologies, especially surgery, activity, and different specialties. So our hospital had only 2 areas of continuous treatment. One was hematology, and I have to say that, like our colleague Michele, and friend actually, Michele, we could actually preserve the bone marrow transplant unit and the hematology department that is encountering around 40 beds. it is completely clean, free from the virus. So no one patient, no one nurse, and just 2 doctors were COVID positive. So very clean. But that was one area. The second was the vascular surgery and heart surgery, according to a decision that our region took in putting hubs for selected activities dedicated in single hospitals. So we were asked to keep the surgery, the vascular surgery and the heart surgery ongoing. So, but now we are thinking of reopening all the activities. So the question is, how did you manage the reopening in those hospitals in which then the COVID activity dropped to, let's say, a definite proportion, but not huge? So, especially for the outpatient management, so the outpatient visits and the referral of patients, how could you manage this? Because this is now the challenge that we have.
There's a question more about management.
Thank you for the question. First, it's great to hear the good news from your side. I think you guys must have been working very hard. We totally understand what you have experienced, and congratulations. For your question, we are facing the same challenge right now. Personally, I believe several strategies are important. The first one is to take good care of the remaining COVID-19 patients. Just try to help them recover soon. The second thing is the strategy we use here is enough self-quarantine time. In our mother hospital, PUMC hospital, we require patients who want to come to outpatient or be hospitalized have a clear history of COVID-19 contact. They should be ruled out of COVID-19 contact for 2 months or 2 weeks. I'm sorry. The third thing I think is symptom surveillance and testing if there is a suspicious patients. If you believe the people have a contact history and he or she is hospitalized, maybe direct testing by PCR is helpful. Anything to add?
I also want to share some of our experience for the COVID-19 patients triage strategy. Actually, in China, in each comprehensive hospital, we have a 24/7 operating fever clinic for the screening, triage, and testing and quarantine for the suspected COVID-19 patients. This is very, very important for the identify the patients and to avoid the spread of the virus.
Can I ask you something again? What about the possibility of being reinfected? Because we have been hearing that maybe in China there are a few cases which reinfected again after the first infection. Is this still possible?
Okay. I personally, I would not use the word reinfection. I think the phenomenon is actually is a repositivity of the swab samples. It is probably because of the false negative result in their previous testing. And we also have some evidence from the animal model. If the monkeys get infected and produce the antibody, then if you re-challenge the monkey with the virus, so the monkey will not get reinfection. So I think so-called reinfection. Okay.
Okay. Is the monkey experiment you were referring to? the possibility to reinfect the monkey is depending on the amount of neutralizing antibodies circulating. I mean, there is a quantitative way of measuring. I mean, if you have a lot of antibodies, you are okay. If you have low titers of antibody, you are at risk. This is the question.
At least in the monkey experiment, all the monkeys have a relatively high titer of the antibody, and after re-challenging the monkeys with the virus, they don't get reinfection. So with the
the titer of antibodies is related to the amount of virus that you use to infect the monkey, or is not depending on the amount?
Well, can we change the answer to this question or discussion to this question from another angle? Actually, we have received the recommendation from the State Council, and they believe the asymptomatic carriers are those who get repositivity in PCR test after recovery might be infectious, which means they might shed virus again. So here the practice here, when the patient got the disease and get hospitalized and get a negative PCR discharged, then later they were sent to the rehab center for 2 weeks of observation. And a lot of them get retest. If they have repositivity, they are going to be observed again for another 2 weeks. I believe it's right now it's not the time to answer this question whether the repositivity is infectious precisely right now. But we believe we have to take very strict precautions in this group of patients, and also a lot of investigations are going on.
Just in one word, it's very rare, so we don't think you should worry about it too much. It's very rare.
Thank you very much.
And I want to add something. Okay.
Can I introduce my colleague, Dr. Padul, that is the rehab doctor, for a question?
Okay.
Yes, I have a question for you. Good morning. Is there a protocol, a therapeutic strategy after recovery from your hospital, after demission in home? And is there a protocol for pulmonary rehabilitation for this kind of patients?
Pulmonary rehabilitation. 肺的康复作用。谭教授呢？干嘛这个？
谭教授这好，你就说到隔离加运动锻炼，配上中药治疗。
I want to share a little bit about our own experience. After the patient was sent back home, and routinely they will also be quarantined for at least 14 days and see whether have fever or any symptoms have developed, and we can also treat them. Use some physical exercise to for their lung ventilation, respiratory function, and also maybe for some traditional Chinese medicine. Yes, that's our experience.
Yeah, but I know it's rare. It's not easy to find some
traditional Chinese medicine there, but if you can get some, just give it a try. Okay.
Yeah.
Okay. Any questions from Mr. Marcello? Yeah, I think you have been working on a program for the pharmaceutical company. Is there any questions from you?
Thank you first for the opportunity to attend this meeting. So interesting and so appreciated to see clinical communities to open communicate. So in this particular situation, all the pharmaceutical companies, as you know, and would both in China and Europe, are collaborating, trying to give their contribution to this emergency. And I think that it has been well clarified how important now is to identify for this emergency, but also for the future drugs, and to be very fast in interpreting the clinical results coming from your clinical experience. So, as Dompet Pharmaceutici, we have had the possibility to lead the European program, and since the very beginning of this outbreak, we engaged a network of collaboration in Europe to start with a specific program aimed at selecting and designing specific drugs for as antiviral. And this is a network involving Fraunhofer Institute in Germany, many European countries, Belgium, viral research in Japan. And this is based on a high-performance computing platform we have developed just specifically to give a fast answer to the selection or repurposing of drugs for new viral infection and emergency. So this is, we hope that in the early future we can give our contribute, but I was very impressed since the very beginning working on the research field on the open communication we had with the Chinese community. As specifically mentioned by the Chinese embassy in Italy, we have had a very frank and open collaboration with the Shanghai Institute of Materia Medica, and we are exchanging materials, information, models, genetic information, and this is incredibly increasing the potential of the research group to come out with an important outcome. So it's very important from our perspective as a pharmaceutical company to understand the needs and to unravel the information that come out from the literature to be guided in putting the efforts in the right direction. So we hope to give a contribute in collaboration between China and Europe with the selection of new potential drugs. On the other hand, you mentioned before how important is the management of the inflammation, and you know how many trials in these patients with acute respiratory distress syndrome has been how many clinical strategies have been tempted, and we are working with San Raffaele Hospital, having a specific experience in the development of interleukin-8 inhibitors and having drugs in an advanced phase of clinical development. We gave our availability to design together with the hospital a clinical trial to assess the potential effectiveness of inhibiting interleukin-8 to manage the high neutrophilia and lymphocytopenia in this kind of patients. So it's so important because the information comes from the Chinese community who have published the immunological phenotyping of ARDS patients, and it's impressive how fast we can create a specific solution if we work together and if we share experience. So I hope that this meeting is one of the meetings we can give, we can lead, and hopefully together we can may give the right orientation to the research and potential for the future.
Okay, thank you very much. Okay, any drugs do we need in treating those patients? We can turn to Mr. Aragletti.
May I ask another thing, if possible? Did you have experience in looking at the tissue? I mean, did you have autoptic cases that you could look into? Because what you were saying before is that there is a sort of discrepancy between the infectivity, the development of antibodies, and the symptoms. And therefore the question is, did you see anything at the tissue level which could tell you that maybe it's not only the infectious viruses, the virus which is causing the disease, but maybe there is any, whatever reaction which worsen the clinical picture and also the tissue performance at the lung level? I don't know, because I've seen some work from China showing that the virus has also neurotropic properties, and you can find them into neural tissue or maybe in other tissues. And can you give us your experience on that?
Okay, Dr. Dean is going to answer your question.
Our doctor will answer your question later. I just want to ask you a question. Did you have any patient do autopsy?
No, we did not, because, as you know, for Italian regulations, autoptic cases should be treated in special containment areas, and at least in Lombardy there is just one of this. But what we are doing is to reorganizing very, very fast our autoptic room. And in few days we will be ready also to have the possibility to do autopsies on some cases. But this is still pending because we need permission and it's not easy. So far we didn't do anything, unfortunately.
Okay.
Okay, just as we said that we have three phases of this disease. And the first, we have the virus infection, and the second, the symptoms getting worse, and the last, in the critical care situation, we are dealing with the complications caused by the virus, but not only the virus itself. And after the big effort by Dr. Zhang and our pathologist, we have some result from the past people, and we can see that the results just show the same manifestation. Just as we said that, we can see that a lot of tissues contain virus, including the lung, and sometimes we can find the virus in other organs, such as a gastro, or sometimes a heart. The kidney, we can see that these organs also contain virus. They can just test the virus in these organs, and that's very new. But in the lung, we can see different types of complications. Sometimes it is the infection caused by the virus, and sometimes we can see some fibrosis caused by the AIDS. And sometimes we can see the bacteria infection of the lung. So you can find different types of pathology result in our autopsy, and that just showed that, and that just added to our belief. These patients, we have to deal with this patient according to their different phases. And at last, you are dealing with not only the virus, but the complications caused by the virus.
We totally agree.
Sorry, when you talk about the virus in the different tissue, do you mean replicating virus, or for proteins which are indicating that the virus is infecting the cells, but also replicating within the cells, or this is just, I don't know, PCR or whatever?
They just, because we just do the PCR test of these tissues, but not means that these tissues are infected by the virus. Or they are live. We don't think they are live tissue or live virus or dead virus, but we only have the PCR positive result of this.
I have something more to add. We generally believe autopsy cases can be really helpful just because you can obtain pathological results from different organs. Generally in the lungs, because I'm a pulmonologist, I found in some of our patients there are infiltration of lymphocytes and macrophages. Also, there can be hypoplasia of pneumocytes, endothelial pneumocytes, especially type 2. Also, you can see multinuclear cells in some of these patients. And also another very hot topic in treating and managing this patient is the usage of corticosteroids. And I'm sure in one of our patients there is a very clear sign of organizing pneumonia, which might indicate that the steroids might be useful or helpful in selected patients due to the results of the pathological results. If you are able to do more autopsy tests, I think it will do great help to these patients and the management of this pandemic.
Okay, I have a question from Facebook audiences. That one of it is that how dangerous is COVID-19 for young asthma patients? Asthma patients. Yes.
We've got a question from Facebook followers. About the asthma. I believe in asthma patients. It's quite similar to those patients in the flu season. They should prevent from getting COVID-19, despite other consequences unique to this disease. Once you got COVID-19, unfortunately, you don't have to panic. Just get recovered from this disease. If you find yourself exacerbation of asthmatic symptoms, maybe you should go to a doctor and seek for plans. Maybe they're gonna regulate or adjust the dosage of inhaled corticosteroids, or provide you with other medications to relieve the symptoms. But generally, prevention comes first. Don't get the disease. Don't get the virus. Then we'll talk about other stuff.
Okay, another one. What types of herbal plants can we consume to increase the body's immunity at home?
Could you repeat the question, please, because we didn't hear.
Yeah, what types of herbal plants can we use to improve our body condition, increase our body immunity at home? This is a question from Facebook, and our doctors are going to answer that. You can also contribute.
It seems like some audience are interested in herbs. Could be Chinese herbs or Western herbs, but as a GI physician, I would say that people always love herbs. But in such a particular pandemic situation, I still don't believe any single herbs or medications could, change the whole picture. Because I think the most important thing to get you out of the trouble to be infected is to be responsible, okay? And wearing a mask. And isolate yourself if you have already got symptoms. And test. So, by herbs, as long as it's unharmful, you can try it. But I still don't believe any single herbs can prevent the infection totally.
Okay.
That's my opinion.
Thank you very much. Any more questions?
Just one question, and then we have a couple of questions. When you were talking about the steroids before, which is, because unfortunately the line was not clear enough, but which is the clinical or laboratory sign that push you to use the steroids? When do you use the steroids in this patient? Which is the sign that prompts you to use those kind of therapies?
Thanks for the question. Well, we generally use this corticosteroids according to the guidelines, international guidelines, which hold a conservative view on steroids, especially on systemic steroids use. But we do believe, and we have seen in selected patients, corticosteroids can be helpful. For example, there can be exacerbation of asthmatic patients or COPD patients. If you want to use steroids, use it. And secondly, there are some people in the process of ARDS might show some features of organizing pneumonia, which may improve with corticosteroids. So, another thing we have to consider is before using corticosteroids, you should carefully select the patients and rule out secondary bacterial infection. You don't want to use corticosteroids universally to everyone. If you want to use corticosteroids, rule out the patient if they have secondary bacterial infection. That's very important.
Okay, because of the time limits, we have to put an end to our today's online meeting. Before we go, I'd like to know how Dr. Martino, how do you think of the meeting today? Has it been helpful?
Can you repeat the question, sorry?
Yes. No, sorry. Fine, you can help me answer the question.
Well, the host asked whether, in your opinion, this kind of webinar is helpful for communication or sharing experiences. Whether it's helpful.
Of course, it's helpful. Of course, absolutely, yes. Science is a common theme. I mean, science is made by exchanging information. This is the basic of science. So we are very happy. Of course, we are happy to share information. Professor Ciceri would like to pose a question.
Okay, one last question. Okay, one last question.
Tissue evaluation from autopsies. There is no doubt that in the lung, the vascular compartment is primarily affected in the late stages. So that massive thrombosis, microthrombosis, is leading to a severe contribution to the respiratory distress finally. So that's very clear. So we are convinced now that we should approach this concept of a microangiopathy more on a concept of a systemic disease rather than just a lung disease. So, because we see kidney failure very constantly, we see some neurological impairment, which can be important, and even some liver damage. That going back, as a hematologist, I would say is nothing different from what we see in the post-transplant microangiopathy or in the, say, veno-occlusive disease is less severe, especially at the beginning. Yes. So my question is the event of vascular thrombosis you see in the lung, did you see any similar pattern in other vital organs, such as kidney or CNS, in the pathology?
So we could not agree with you more. Because as we daily to see the patients, we have noticed that their fingers and toes, the tips of the toes and the fingers, clearly show the signs of ischemia. And also the autopsy told us that there are extensive microthrombosis in the patient's body. So we recommend that we should monitor D-dimer and other tests for the DIC. If you find a positive test, you should use low molecular weight heparin routinely to prevent the situation to get worse. And also to conclude today's communication, I would like to add my own comment. Because as a person, I'm a lover and a taster of Italian wines. With all my heart, I love Italian wines. So I would like to wish you guys good, best of luck to get through this and get back to your life as soon as possible. Thank you.
Thank you very much. Thank you for your time.
I can have some good suggestion for you. So you send me the address, I will send you some wine.
That's right. Thank you very much.
Thank you very much.
Thanks again for your time. Thanks again.
Good one. I mean, the good one.
Okay.
The good one. Yeah.
Okay, thank you very much.
Just a final question. Did you have any experience with the drug which is approved for microangiopathy and VOD, which is defibrotide?
Defibrotide.
Did you have any experience with that?
No, in fact, we don't. We don't yet.
Okay, because we are starting a trial, so we will update you. So we thought we have much experience in VOD and in microangiopathy following transplant and with that drug. And we will try to approach with that hypothesis, just looking at the event. So
Yeah.
Luca has something to ask you.
I just wanted to make a comment about the possible DIC that looks like some patients experiencing the advanced stages. This is from the virological point of view, it's not really a common DIC, meaning that it's different from the DIC that people develop after sepsis or big traumas. It looks like more microthrombotic diseases that is reminiscent of certain viral hemorrhagic fever infections, antivirus infections, and we should put effort into the research of this phenomenon, because it's not really at the end an overwhelmed production of tissue factors that leads to a major production of thrombin, but it looks like really the microangiopathy that typifies certain viral hemorrhagic fevers, and we should model that to understand better, especially in the animals, this phenomenon, to develop, to experience repurposed drugs that might impact these late stage episodes of disease.
Okay, thank you very much. We'll look on into it. Okay, and thanks again for your time. The guests from San Raffaele Research Hospital, Iguado Hospital, and also Mr. Marcello Adaglietti, and also special guests, Mr. Yao Liangjun and Dr. Giussi Condoletti. Thank you very much for participation. And as we know that the whole world is kind of shutting down and in the struggle to get a grip on COVID-19, one country after another, including Italy, is demanding that its people shun society. Local medics have been working very hard in the battle against the virus, but still risks of further spreading by sporadic, imported, and asymptomatic cases still exist in China, and the country is still working very hard to fight the virus. But we do hope the experience our medics got at the front line can help doctors and nurses around the world with their battles. And that's all for today's online medical consultation. Stay tuned, and bye for now.
Bye.
Bye-bye.